Hey, my name is Ben Thompson. I have this YouTube channel focused on tinnitus and hearing loss. I asked my community what would be the best video to help you with tinnitus right now, and the community responded by asking for the topic of how to manage tinnitus at night. This topic is important because sleep directly impacts stress and anxiety levels, and it's hard to make real progress of getting over and recovering from tinnitus if I'm stuck in my stress and anxiety and if I'm struggling to fall asleep every night. In this video, I'm going to talk about what you can do for the few hours before sleep, what you can do during the day to set yourself up for good sleep, and then how to adjust your sound therapy or the sound in your environment to help you enter and stay asleep. If you watch this video until the end, I will give a case study of a patient that I worked with via telehealth. This is pure tinnitus. Hey everyone, this is Ben here. Thanks for being on my channel. Make sure you're subscribed if you're not already. I want to start by describing a 2014 study that looked at sleep and associated sleep disorders for tinnitus patients. It turns out that 2 out of every 3 tinnitus patients in this study had an associated sleep disorder. Typically, this was insomnia, and that means having a hard time falling asleep or staying asleep. A lot of those patients had high stress and anxiety levels. But the good news is that for those patients who worked with a tinnitus therapist and who used sound throughout their day, either by having a sound-rich environment or by using devices on their ears like hearing aids or sound generators, that they were able to improve their sleep significantly in this study. And guys, I'm excited to share 4 tips that I feel are the fundamentals, the essentials for setting yourself up for success with sleep. If you're watching this right now and you're having a hard time falling asleep, I want you to put these 4 tips into practice consistently for 2 weeks and let us know in the comments how it works for you. Tip number 1, getting a good night's sleep starts at least 1 hour before you hit your bed and you try to fall asleep. This means having a wind down routine. For me personally, I try to have a meditation practice. I try to turn off my phone. I try to lower the lights. I don't look at screens for about 30 minutes to 1 hour before I enter sleep. That means my body, which takes time to transition into a restful state, my body is calm, my body is relaxed, and that sends messages through the nervous system up to my mind that it must be time to sleep. Some specific tips that might help you out would be to drink some warm herbal tea before you go to sleep. Turn down the bright lights in your room. Put your phone on airplane mode, turn off your computer, turn off that technology, and maybe consider taking a warm shower or a warm bath sometime before you enter sleep. All of this relaxes the body and that's going to help you out. The second tip here would be relaxation practices. In my experience, this is something that's often overlooked and probably advice that you won't get from a typical doctor. But in my personal life, I know that relaxation practices help me sleep significantly. And for someone who has tinnitus, who's looking for everything they can do to help get their life back to normal or help manage their tinnitus at night when they're trying to sleep, relaxation practices might be the key that you're looking for. This could be something like deep belly breathing, and not just for 3 breaths. We're talking lay down, get comfortable, put down a soft pad on the ground or lay down on your bed, put your hands on your stomach, take deep inhales, deep exhales, nice and slow, feeling your belly rising and falling. You might prefer something a little more dynamic in the body, so you can try stretching. Some types of yoga are beneficial, yin yoga or yoga nidra. You can search those on YouTube and get access to some guided, slow, gentle stretching of the body, which relaxes your body and tells your mind it's time to go to sleep. A lot of people are telling me that guided meditation helps with their tinnitus. I'm happy to know this. I've practiced meditation for a number of years. I teach people meditation. I have a meditation series that I've created which has helped people with tinnitus. And meditation also is used to get out of the mind and relax in the body. Guided body scan is a type of meditation, and that can also be used as part of your relaxation practice. Tip number 3 is to use sound therapy as you're entering sleep into your bed. A lot of people have a fan in their house or a white noise machine or an air purifier. A lot of times that's all you'll need to get into that calm place to enter sleep. The way that people use this is they turn on the white noise, the fan, the air purifier, the white noise maker, the white noise machine, maybe some nature sounds, and that noise is at a level where your tinnitus isn't so loud, so that when you're trying to fall asleep, your mind is not like a pinball machine focusing on the tinnitus in a quiet room. Instead, there's a lot of noise, there's a lot of stimulation, and it's easier to get into that habit of letting the white noise act as a stimulus to tell your body and your mind, okay, now it's sleep time. The tinnitus isn't so loud, I hear this other noise, I've had these relaxation practices, so by the time I enter sleep, it's a smooth transition and I'm spending less time awake in my bed, stuck in my mind, stuck in the worrying, catastrophic thinking, the anxiety, the mental stress that can often happen when you're struggling to fall asleep. Instead, this noise can help put you to sleep faster and stay asleep longer. Tip number 4, if you've tried the 3 tips before and you've seen some progress, but you're looking for what else you can do, you can try something called a guided sleep audio. I wasn't sure about this, but once I tried it, it really worked. I was having a hard time falling asleep. I was feeling anxious. I was thinking about tomorrow. I was thinking about next week. This was a period of my life where I had a lot of anxiety and worry. I used the guided sleep audio where I laid down in my bed. I played the guided sleep audio on YouTube or Spotify from my phone. And the specific one that I used was from a group called the Honest Guys, and they're on YouTube. And it basically led me through a progressive muscle relaxation. Arms, chest, legs, feet, back up. I kept doing this. They have their own guided style. I kept doing this for about 10, 15 minutes, and I was asleep before the video ended. So it didn't take me that long to actually knock out into sleep. It took me about 15 minutes of their guided soundtrack to go from anxious, worrying, having a hard time falling asleep in my bed to fully rested, didn't wake up for that night. One of the members of Pure Tinnitus Group Coaching, they told me that they use the day 7 of the 7-day tinnitus meditation challenge, where the recordings are in the group coaching members area. They used that day of the meditation challenge for tinnitus to help them fall asleep at night, because it was soothing to hear my voice guiding the meditation, which was a similar muscle relaxation guided body scan, that helped them fall asleep. And I wasn't expecting someone to be using these sounds to help them fall asleep, but it makes total sense when someone wants that relaxation and to get out of the mind once they're in a sleep state or trying to fall asleep. I recently worked with someone one-on-one via telehealth who was in their 30s, who got tinnitus in one ear very loud, and then it crossed over into the other ear. They were having high stress, high anxiety. Their sleep really suffered. And what they told me and what we figured out worked for them was having a lot of sound, having a sound-rich bedroom, so that they turned all these sounds on and it was soothing, it was relaxing, it was low-level, white noise, and other types of noise, so that helped them transition into sleep much easier. They also wore a headband which has some noise coming from it. There's options to get Bluetooth, or you can just get one of these headbands. You can search for them online that plays white noise from the headband. So because that's so close to their ear, that helped them relax. It helped them mask their tinnitus when they were trying to enter sleep. It's totally okay from my perspective to mask your tinnitus when you're entering sleep. The most important thing is to get a good amount of sleep, to get restful sleep. You can mask your tinnitus in the night. So that's a case study of someone who used a headband and white noise in their room, like environmental sounds and nature sounds, to help them ease into sleep and get good, restful sleep. Why are you watching this video? Let us know in the comments below. How has your sleep been with tinnitus? What questions do you have for the community here? What has worked for you? What are you struggling with? And what kind of help might you want about how to optimize your sleep for tinnitus? Another big question, which we didn't cover in this video, would be drugs like melatonin or anti-anxiety, antidepressant medication, and how is that used for sleep? We're going to talk about that in some of our other videos. Make sure you're subscribed to this channel if you're not already. For the next video I recommend you watch, it's called Tinnitus, Stress, and the Limbic System. You can click that to my side. I'll see you there. Thank you guys. Bye.